I'm Dr. Choate at the Spinal and Sports Care Clinic, going to demonstrate how we would use the spinal decompression table on somebody's lower back. And keep in mind that when we evaluate people, we are screening them to determine if they're a good candidate to be on this table in the first place, because people think they want traction and decompression, but they may actually not need that. So we always do a full evaluation to determine who are the best candidates for this table. And there are some people that are not good candidates at all, people that have advanced osteoporosis, people that have an active disease process, let's say like an inflammation-based process, cancer, infection. Those are some of the types of things where we would say no good on the spinal decompression. But for most other people, they're good candidates, but we do screen them, mostly determine which is the proper position to set them up on the beginning, because there are some people that will like it in this position here, but others actually do better when they're laying face down. So that's something that we always want to make sure that we dial in very precisely to give people the best chances of receiving benefit from the table. So here we go. This is how we would set people up in the face-up position. So first thing we do is get them properly positioned, apply a nice strap, and then this is the actual anchor strap that will provide the bulk of the pull. So we get that, and I snug it up pretty tightly there. Okay. Then we have a secondary strap that helps to secure the upper back in place so people don't slide around. There we go. And then to keep people from sliding down on the table, we use these pads underneath the arms to help keep people in place. So just lift up a little bit. There we go. Just like that. Now they're nice and secured. And then this is the cable that actually provides the pull. We will connect that. And the last thing for patient comfort, most people will like big bolsters underneath the legs so that people don't have to hold their own legs up in place. Good there? Okay. So now we are ready to go. All we need to do is disengage the locking mechanism, so then the table is allowed to pull. We've set some numbers already in terms of the amount of time that the pull will be for, 14 minutes. This will be a 100% rate of pull, so it goes more quickly. And then we've adjusted the time or the amount of pull already, and that's going to be between 70 pounds of pull on the high side and 50 on the low side. And so we are ready to go. We push the button and things will be ready to engage. Now the table, what's nice about this is that it increases its amount of pull in increments. So for the first, every 10 seconds, it will go up a little bit more, and every 10 seconds, it will continue to rise until it reaches its maximum amount of pull. Once we get to that maximum amount of pull, we can decide whether or not that amount of pull is adequate. So we go with a lot of patient feedback on they feel like they can handle more pounds for pull, then we'll increase it. If it feels like it's too much, obviously we'll back off on that. And there's always a change between the maximum and the minimum. We try to keep that at least at a 20-pound differential, so that once they reach that top amount of the pull, in this case 70 pounds, it'll maintain that for exactly 1 minute. Then when the 1 minute elapses, it'll reduce down to the secondary amount of 50 pounds, and that will maintain for 20 seconds. Now they're on a cycle of 1 minute at the higher amount of pull, 20 seconds at the lower amount of pull. And it will go back there for the duration of the cycle until eventually, when they get to the end, then it will ramp down in increments the same way that it kind of started the whole process. So it's a very slow start, a slow finish, and then you got that traction in the middle that gives us the benefit. So we're at the full amount of pull right now, which is 70 pounds. Feeling okay? It's all right? Comfortable for you? And we have two things that we like to do. This is a safety feature on the table, which allows a person to interrupt the process should there be any kind of problems along the way. So if the person has sciatica and they've got right leg pain, we might say, if the leg pain gets worse while we're doing the traction, we certainly don't want that. So hit the button and that will pause the table. So we like to leave that within reach of a person. They can do that anytime. And then we also have a little extra safety feature where we put the dinner bell that people can ring anytime they have any kind of a problem. And we're trained here, when we hear the bell, we come running because we know that there's maybe a potential issue, but that generally doesn't ever happen. And then that's it. That's the whole process. And then when everything is done, we'll ask afterwards how things went. It's not uncommon to feel sore after decompression treatment. And the reason is that because when we're pulling, we're not just pulling on that lumbar disc that might be bulged. You're pulling on skin, fascia, muscles, ligaments, all other types of connective tissue, and you can't help that. That's just going to happen with spinal decompression. But those tissues are also not used to being pulled on, so you can be sore afterwards. And that's very much like going to the gym. If you haven't worked out in 6 months and you go lift weight, what's going to happen the next day, right? You're going to feel sore. So that's okay. Soreness is acceptable as long as it doesn't get too crazy. We tell people usually to ice and just kind of take it easy for the next day or two to make sure. But that soreness oftentimes dissipates with repeated treatments. And that leads me to one other thing, which is when we do spinal decompression, for the lumbar spine in particular, we usually recommend a package of visits because one time is generally not enough to fix a disc herniation. And so a person, if they're faced with the potential issue of needing surgery for their lower back, this is a non-surgical alternative to treatment of disc herniations. And so it might take some sessions. We usually offer a 10-visit package where you can do 10 visits at maybe 1, 2, or 3 times a week while we're trying to get those changes in the condition, get them under control, and hopefully keep people from having surgery. And we have documented cases where people were able to avoid surgery as a result of doing this spinal decompression therapy. Nothing works for everybody, but it is a great tool that we have, and we're happy to have it. And so give us a call if you want some more information about spinal decompression therapy.